And hospitals are emerging from another wave of COVID-19. Omicron cases are fading, but severe staffing shortages are pushing healthcare workers to the brink. Fox 43's Rocha Yankunis spoke with doctors and nurses about what it's like inside Pennsylvania hospitals 2 years into the pandemic.
A lot of people ask me, why do you stay, Erin? And I stay because this is my family.
You can't beat that.
No, you can't beat that. Hanover's my home. It's my home.
Erin Schock is an ER nurse at UPMC Hanover, healing the very community where she grew up. But the pandemic has forced nurses like her to make heartbreaking decisions.
I have nightmares every night. We would have to decide who would get beds first or who was going to get which hallway bed first. I've held people's hands that have died in these rooms that I've known, and I get a text later that tell me, I'm so glad you were there, Erin. It helps me know you were there. That's why I stay.
Because they couldn't be there.
Because they couldn't be there.
But so many nurses are leaving the bedside. Hospitals are seeing a staffing crisis, pushing nurses that are still left to a breaking point.
So many of our nurses have worked tons of overtime, anywhere from 50, 60, 70 to 72 hours a week to fill in holes.
For nurses in the ICU, waves of new infections and deaths are leaving them exhausted. Statewide, less than 30% of ICU beds are available.
Comparing the number of patients that do get better and do make it home to those who don't, what's that ratio? How often does that happen?
More patients than not do not make it home once they come down here. I love caring for people. I love being part of this community and knowing that I'm making a difference in this community. But it's really hard. We all got into this job because it was our passion to help people and see people get better. Most of the time, it's a losing battle.
Hospital staff is stretched thin even as Omicron begins to fade. But a drop in cases means hope is on the horizon.
Unfortunately, we don't know where this will go. But we are taking the opportunity to take a breath and kind of regroup.
Have there been any rewarding moments?
Absolutely. That camaraderie that we've developed, that teamwork that we've developed has been incredibly rewarding. They have given blood, sweat, and tears throughout this process. So I just think it's really important that we continue to thank those healthcare providers.
In search of learning what it's been like inside hospitals during the pandemic, we found what has been holding healthcare workers together.
There's our team. Love you. Love you guys.
I am so proud to save lives beside my coworkers. They are top notch. I just would shout it from the rooftops if I could.
And our healthcare system is depending on people like them. I'm Rachel Yankunis, Fox 43 News.